In that I think most people these days think ABA is for young children and it's for children with autism. And yes, it is gold standard for that. But applied behavior analysis is also for teenagers and adults. In fact, if you look at our history started with adults. Right. And then with teenagers, with time, it also then morphed into young children.
Welcome to the Optism channel, where we journey with Carmen to raise autism awareness and move steps closer to inclusivity. Join us as we meet community members, share stories, and explore initiatives that make a real difference.
Applied behavior analysis is just based upon how people learn, whether you're a child, an adolescent, an adult. So it's not just for young children, nor is it just for autism. You know, if you look at the gold standard of treatment for ADHD, it's again applied behavior analysis. If you look at things like anxiety disorders, the specialists often are doing cognitive behavior therapy, applied behavior analysis. So ABA is not just for autism either. My wife is a marriage and family therapist, an amazing one. She's trained in applied behavior analysis. She's doing very different work than she did long ago when she worked with children with autism. But the foundation is really the same. It's about teaching. And so you have someone with depression or marital issues, you're doing teaching, which is a real, again, applied behavior analysis.
This is very enlightening because I've always understood it as therapy option for younger kids, but I guess it could be universally applied.
It has been, and it is. I mean, yes, I specialize primarily in autism, but I started my career in ADHD. As a licensed therapist, I treat depression, I treat anxiety, I work with marital issues. I was trained in that as well. For 15 years of my career, I worked only with adults, all under the umbrella of applied behavior analysis. But I also want to clarify, not all ABAs are the same.
Yes.
And I think there's this understanding, this belief or thought that if you do ABA and one agency does ABA, another agency, it must be very similar. And it's vastly different, in how you apply it. It's like, someone that's a speech pathologist or a medical doctor, they practice differently. And with an ABA, it's very different.
How would you define effective ABA then?
The term we use is progressive ABA versus more traditional ABA. And there's a vast difference. 95% of the people that do ABA I put in the category traditional ABA. Only about 5% do progressive ABA. And the differences are things like individuality. Unfortunately, most ABA is very we call protocol driven. They use the same kind of treatment regardless of the age of the child, the functioning level of the child. They don't individualize. Good ABA is highly individualized. Every child is different. You have to individualize your treatment to that specific child. And even that child will change. 9 o'clock will be, present differently at 10 o'clock. You've got to change because they're different at different times. And so you have to be really well changed to assess the differences and individualize. That would be one really prominent difference between ABA. I think another difference is what you focus on. Unfortunately, traditional ABA is very limited what they focus on, mostly behavior, maybe communication, language, which is important to focus on. But progressive ABA also looks at social skills. They look at independent living skills, play skills, recreation skills. Good ABA is treating the whole child. They're also looking at supporting the family as well, which is another difference between traditional ABA and progressive ABA. When we're seeing a child with autism, we're also helping the family. We recognize that the stress, the strain on the family. We recognize that although they may be in treatment at a clinic, they're coming home and parents need help in that too. It affects siblings as well. So again, for me, from a progressive ABA approach is looking at the whole child and the family as well. A big difference between that. I often say I have a love-hate relationship with ABA. My love is I've done this for over 50 years. It's my career. It's my passion. I love ABA.
How did you first get involved in the field?
But let me tell my hate. My hate of ABA is most ABA I think is quite poor. It's very rigid in what it does. I'm uncomfortable with that because it doesn't help children or families if you're using a more rigid approach.
Right.
And it's not their fault, by the way, they're just not well trained. And that's the other distinction I'd make, is that in our clinics, our staff are well trained. It's not time-based. It's based upon how much time they need for training. So in most places that do ABA, it might be 1 week or 2 weeks. In our clinics, it might be months that they get training, and then training never stops. And so there's vast differences. The only last thing I'd say, I'll get to how I got into the field, is that it's about things like intensity. Unfortunately, in most places, clinics are providing the wrong dosage, wrong intensity. So I know in Hong Kong, there's many clinics here where children are receiving like 15 hours a week of ABA, whereas the research is abundantly clear that 15 hours of ABA in most cases is not enough at all. And there's research that shows sometimes 15 hours is no better than 0 hours. It doesn't make a difference.
In your opinion, if the child actually requires intensive ABA, would you even say that they should actually remove the child from school?
Absolutely.
Wow.
I don't want a child to go to school until they're ready. We use the expression I use, I don't want children just to survive, I want them to thrive. Our children can have tremendous potential, and they need the therapy so they can reach that potential. I want our children to go to school. I want our children to go I want them to be in general education without supports. And we have research that we've done that shows about 70% of our children get there. They get to general education without supports. But I think one reason is not only are we using a progressive approach, we provide the right intensity of therapy, and we also make sure not to put them prematurely into school. I think parents and professionals have this view of a certain age they go to school.
Yes.
And from my standpoint, if they're not ready, why would we put them in that situation where they're going to just survive, perhaps, and some is not that. So yes, I think that children should wait till they're ready to excel in school.
Okay, that's really good advice. I guess onto my next question is, how did you get involved?
How to get in the field? Completely by accident. I went to University of California at Los Angeles, UCLA, as an undergraduate, only because my dad went to UCLA, and I followed UCLA's athletics and sports, so I wanted to go there. I was a poli-sci major going to law school, so I thought, studying for the LSATs, ready to go to law school. It was my junior year at UCLA. I needed a class on Tuesdays and Thursdays, only so I could go to school only 2 days a week because I was working to put myself through school. I took a psychology class just because it sounded interesting. And it turned out the professor was a pioneer in the treatment of autism. I had no idea what autism was whatsoever.
Especially back in the day, yes.
Yeah, it was in the early 1970s. And so I took the class, and I was fascinated. In the first week of the class, I went home and said to my parents, I'm not going to be an attorney. I want to be a psychologist. I was enamored with the field. And so I just dove into it. So it was completely by accident.
Do you want to share a success case that you feel very proud of?
I've been doing this for a long time, so I have a lot of cases that I'm really proud of.
A case that really touched your heart.
There was this little boy I treated who was 19 months of age when we saw him. He didn't have a diagnosis yet, and I could see why. It was kind of tricky. Did he have an intellectual impairment? Did he have autism? Did he have both? And we were unsure. Nonetheless, we started treatment, because I often say I don't treat the diagnosis, I treat the child. So whether he had an intellectual impairment or whether he had autism, there were tremendous deficits that he did have. We started treatment. It was slow, tricky, and it turned out we were pretty convinced after 6 months it was probably autism. But nonetheless, it didn't affect our treatment because we were treating looking at his deficits. It took about 1.5 years for him to have really making nice progress. It was slow. And I remember thinking, I just don't think he's going to reach where I thought he could, his potential. I don't think this is a little boy that's going to go to general education. I think he's going to need to have supports the rest of his life. That's fine. It's not what you hope for, but you try to help as much as you can. And after 1.5 years, he just started blossoming. And I was just amazed watching him blossom, the effect it had on the family and seeing them, their happiness and satisfaction. End of the story, we treated him for 7 years. long time. He ended up going to school, general education. His testing came out of the normal range on everything.
Wow.
Friendships, high quality of life. And I guess it touched me not only because of his outcomes, but the effect it had on the rest of the family as well. That would be the one I think off the top of my head.
Beautiful story. My last question for you would be, parents oftentimes really want to stay on top of things with a child. Now, how often should we have them assessed? And what kind of assessment should we actually have them enroll in?
I'm going to go back to it depends who's doing the assessment and the quality of the assessor. Yes. We typically assess our children in a more formal way every year to 2 years.
Okay.
That's what we usually follow. The assessment we use depends on what we're looking for. Are we looking to determine if they are ready for school, as an example, and how they're going to do in school? Then we could do more of an IQ test if that's what we're looking for. If we're looking for social skills, there's tests on social skills. We'd be using that. So it comes down to what we're really looking for. Okay. And we look at it to guide us what we need to do. We're not looking at it from just getting straight numbers and not doing anything with those numbers. Does it change our treatment? That's how clinically we use assessments. We also do research though too. We do a lot of research publications. And so we use testing for that too, because we're published in journals and we have to show changes. So when we're doing research, we do full batteries of tests, including IQ tests and speech and language evaluations, and social skills.
I guess from a parent standpoint, it's also very important for us to stay on top of the game, to be well informed as well on what the latest research is and what the latest studies are, I suppose. Which is a lot of work.
It is a lot of work. Ideally, you can rely on some professionals that can help guide you within that. But it is looking at research, and research is important. And I had a parent today that talked about a treatment that she's looking into. It says it's been proven. And it's like, what does proven mean? Is it just because someone's on the internet says it's effective doesn't mean it is. Or even, sadly, you can look at research journals, and that doesn't show it either. There's different kinds of journals, research, and there's those that use really good experimental design, and those that don't, those that rely on anecdotal reports. So you have to also look at the kind of research that's being done. You have to look at the type of journal. So there's a lot of work in that. I get calls at least once a week from a parent that questions a kind of treatment, and they will always say there's research, they see it's been research based when it's really not. Goes back to, you got to be a careful consumer. You've got to look at what research is, and is it good research versus not good research. Is it based upon parent report, professional report, that's not grounded within research.
Well, it's a fascinating topic, and thank you so much for your expert insight today, Dr. Leaf.
My pleasure.
Thank you so much.
Thank you so much for having me.